often we hear about RPA applied to things like back office admin and things like that, which is hugely important. But there's a challenge that I'm currently exploring and working towards, and its aim is to directly improve patient outcomes. And in this case, the outcome is actually keeping them alive. So it's really exciting. So in critical and emergency care, unfortunately, it's often the case that communication between emergency services like ambulance, air ambulance, rescue services doesn't reach, the right information can't get to the receiving hospital in time. Quite often it's just a phone call, if that, if somebody is there to answer the phone, and a lot of the right information is just not available, perhaps until the patient actually arrives at the door of the hospital. And what happens then is that the optimal people, medications with the understanding of the patient history is not in place when the patient arrives. And those lost seconds and minutes, often in an emergency situation, can result in a loss of life. And evidence suggests that it does quite regularly. So this is something that's really important to tackle. And what you need are things like information on the patient current condition, their history, treatment already administered. If that can be provided in advance of the patient arriving, then we can ensure the optimal treatment. So it sounds simple, but it's very difficult to achieve because everything is happening right now and needs to happen yesterday almost, because it's such an emergent situation. So technically, we're quite confident that we can, dramatically change this really. It's probably a combination of some sort of app and a portal, with automation and AI, for instant data retrieval. The challenge really is around ensuring that that data in transit is secure, but also that it's reliable, and the access to data. So the source data, because it's quite likely that the treating hospital that the patient is being sent to doesn't hold their entire medical history. So we need to ensure that data capture piece is in place, that we can get the access to the data. But it's something that we're working towards and quite excited about, and we'll be implementing quite soon. So that's one that's, I guess, making one of those real life-saving impacts where this technology shows it can make a difference. So that's something I'm very excited to be working on.